Hello everyone. So today we will be discussing about pharmacology in sports, drugs and sports. Before we going forward, we will see the famous athletes who were caught using drugs in sports or enhancing drugs which enhance the performances. Maria Sharapova is a tennis player in 2016 suspended for 2 years for doping. Sharapova claimed she was unaware that a drug she had been using for a decade, meldonium, which helps in increasing in blood and oxygen flow, had become a banned substance as of 2016. Next up, Lance Armstrong. In 2012, his seventh Tour de France title from 1999 to 2005 were revoked in 2012 after a year of suspicion culminated in the exposure of an elaborated multifaceted doping scheme within Armstrong U.S. Postal Service team. Next up, Floyd Landis. In 2006, he was stripped of his Tour de France title for testing positive for synthetic testosterone. Next up, the Russian team in 2012, 2014, 2016. Russia has been accused for running a state-backed systemic doping program for years. As a result, the Russian Olympic athlete competed as neutral Olympic athlete from Russia and banned from using their national flag or anthem in 2018 Pyongyang Olympics. Then Martina Hingis in 2007, having initially retired in 2003 at the age of 22, Martina Hingis tested positive for cocaine in 2007 at Wimbledon in her comeback year. She was suspended from tennis for 2 years. Next up, a cricketer from Pakistan, Shoaib Akhtar, in 2006, Shoaib Akhtar found guilty for using steroid nandrolone used to aid recovery from injury, increases muscle size, strength, power, and increase aggression. Next up, a very greatest footballer, Diego Maradona, in 1994, the Fallen Angel. He was tested positive for ephedrine at Soccer World Cup in the US in 1994 and was excluded from the tournament. Next, we have Narsingh Yadav in 2006. He is an Indian wrestler, was slapped for a 4-year ban after testing positive for methanol just week after before 2016 Rio Olympics. Controversy on his ban is still ongoing. Next up, Kumukhuncham Sanjita Chan. In 2018, a sample tested positive for testosterone, resulting in immediate provisional suspension by the International Weightlifting Federation. Doping in sports. Flaw of presentation, drug abuse, risk factor model, reason for abuse, drug abuse in sports, introduction, history of doping, Indian statistic, reason for doping, mechanism of doping, 2019 list of prohibited substances and method, and anti-doping agencies. Adverse effect of doping, testing and investigative procedure of athlete, sample testing protocol, therapeutic use exemption, designer drugs, role in sports and detection, sports medicine, role of sports pharmacology. Defined as the international non-therapeutic use of drug product or substance, even once to achieve a desired psychological or physiological effect, known as drug abuse. A persistent or sporadic excessive drug use, inconsistent with or unrelated to acceptable medical practice. Substances Abuse and Mental Health Services Administration, USA, estimated 21 million Americans aged 12 or older. 7.8% of the population required treatment for substance abuse in 2016. Continuum of dependence. First use, social use, regular use, risky use, dependence, substance use disorder. The risk factor model says that biologically genes or environment, the drugs use, the route of administration, effect of drugs, early use availability cause, and the brain mechanism causes addiction. Can be genetic, gender, mental disorder, and environmental factors are chaotic home and abuse, parents' use and attitudes, peer influences, community attitudes, poor school achievements. Drug abuse and youth. To fit in, teen use drug because others are doing it. They think others are doing it, and we are not being accepted in a drug. Using social circle, feel better, depression, social anxiety, stress-related disorder, and physical pain. Stress plays a significant role in starting and continuing drug use. To experiment, motivation to seek new experiences, particularly those perceived as thrilling or daring, to feel good, abuse drug, interact with neurochemistry of the brain to produce feelings, pleasure, and euphoria. To do better, ours is a very competitive society. Pressure to perform athletically and academically can be intense. Using illegal or perception stimulants for enhancing or improving performances is prevalent. Drug abuse in sports. Doping defined as use of drug or other substances for performance enhancement. Drug abuse in athlete population involves doping in an effort to gain competitive disadvantage. Alternatively, may involve use of substance such as alcohol, marijuana, without the intent of performance enhancement, since athletes may develop substance use disorder just as any non-athlete may. Most frequently detected doping agents by WADA, regulated dope testing laboratories, anabolic steroids, stimulant, cannabinoids. The history of doping. In 3rd century BC, brandy and wine concoctions, hallucinogenic mushroom and sesame seed to enhance performances. Then in 1904, illegal drug of racehorse in the Olympics. In 1920s, mixture of strychnine, heroin, cocaine, and caffeine were commonly used by higher level athletes. In 1930, amphetamine replaced citrine as a stimulant of choice for athletes. Use of PDs in the Tour de France was common practice. In 1950, Soviet Olympic team first used male hormones to increase strength and power. The history of doping again continuing. 1967, International Olympic Committee (IOC) Medical Commission established a list of prohibited substances. In 1967, introduced anti-doping testing of athletes in 1972 Munich Games. Anabolic steroids were added to the Indian International Olympic Committee prohibited substances list in 1976, resulting in a marked increase in the number of doping-related disqualifications in late 1970s. The International Olympic Committee identified and banned blood doping in 1986. In 1990s, erythropoietin was included in the IOC list of prohibited substances. IOC took the initiative and made the first World Conference on Doping in Sports Lyceum in February 1999, following the proposal of conference as World Anti-Doping Agency (WADA) was established in later 1999. The Indian statistic, India ranks 6th in the latest doping violations report published by WADA in 2018. India had 69 anti-doping rule violations, the same as Russia, which has been under international scrutiny for a while. Athletic 21 offenders, weightlifting and powerlifting 14 each, kabaddi 9 offenders, wrestling 5 offenders. Reasons for doping: pressure to perform, speed up an injury healing process, ignorance and accidental consumption, push natural performance limit, repeated failures. Now we will have a look on the mechanism of doping. The mechanism of doping involves strength enhancement by weightlifting, wrestling, anabolic agents, salenitrol, testosterone, nanodrolone. Second, to output of energy in 100 meters sprint, amphetamine, cocaine, ephedrine. Third, hand steadiness, shooting, archery, beta blockers, body pliancy in gymnastics, growth hormone, endurance, cycling, marathon, erythropoietin, weight reduction, boxers, jockeys, diuretics. Here are some drug types abused by the athlete. Effect to athlete, enhance alertness, amphetamine, caffeine, cocaine, used in baseball, basketball, boxing, cycling, judo, gymnastics. Relax blood vessel or heart, alcohol, cannabinoids, beta blockers, used in archery, diving, pentathlon, shooting, increase oxygen delivery in tissues, protein, neurohormones, artificial oxygen carriers, blood doping in cycling, marathon, skiing, swimming, control weight diuretics, mass drug use, epistrone, plasma expanders, secretion inhibitors, diuretics used in athletics, boxing, equestrian, judo, rowing, weightlifting. To build mass and strength, anabolic, human chronic gonadotropin, luteinizing hormone, growth hormone, insulin-like growth factor, insulin. In throwing, weightlifting, football, American. Mass, pain or injury, the protein hormone, narcotics, local anesthetics used in football, cycling. Here are some list of prohibited substances and method. In 2019, the prohibited list of cornerstone of the World Anti-Doping Code, updated annually following an extensive consultation process facilitated by WADA, valid from 1 January to 31st December in 2019. The updated annually following an extensive consultation process. This is followed by NADA as well. Three subcategories per substances and method banned all the time. Substances banned in competition. Substances banned in particular sports. The substances, known approved substances, anabolic agents, peptide hormones, growth factors, related substance and mimetics, beta 2 agonists, hormone and metabolic modulators, diuretics and masking agents. Substances prohibited all the time are defined here. You can see the category and the examples. Non-approved substances, no current approval by any government, regulatory health authority of human therapeutic use. Example, drugs under preclinical or clinical development or discontinued. Designer drugs, substances approved only for veterinary use. Substance 1, the anabolic agents, anabolic androgenic steroids. Exogenously, substance which is not ordinarily produced by the body naturally. Endogenously, substances ordinarily produced by the body naturally. It is aldosterone, danazole, oxabolone, and etc. S2 are peptides, hormones, growth factors, related substance, and mimetics. EPO and like agent, erythropoietin receptor, hypoxia inducible factor, TGF beta inhibitors, innate repair receptors agonist. Example, argon, daprodustate, moltidustate, agialo, carbamylated EP. Peptide hormones and their releasing factors, chronic gonadotropin, luteinizing hormone, corticotropins, growth hormone and its fragment and releasing factor. Buserelin, disolorelin, corticosterelin, sarmorelin, and grelins. Here are some more categories. As you all can see, the drugs, beta 2 agonists, hormone and metabolic modulators. We have diuretics and masking agents, except drospirenone and palmabrom, and ophthalmic use of carbonic anhydrase inhibitor, dorzolamide, brinzolamide, local administration of phyliprecin in dental anesthesia, desmopressin, probenecid, amiloride, bumetanide, canorenone, etc. Manipulation of blood and blood components. Administration for reintroduction of any quantity of autologous, allogenic, homologous or heterologous blood or red blood cell products of any origin into circulatory system, artificially enhancing the uptake, transport or delivery of oxygen, efaproxyrol, RSR13 and modified hemoglobin product. Hemoglobin-based blood substitute and microcapsulated hemoglobin product, excluding supplemental oxygen by inhalation. Any form of intravascular manipulation of the blood or blood components by physical or chemical means. Chemical and physical manipulation, tampering or attempting to tamper to alter the integrity and validity of sample collected during doping control, including but not limited to urine substitution and or adulteration. Intravenous infusion (IV) of more than a total 100 ml per 12-hour period except for those legitimately received in the course of hospital treatment. Gene and cell doping. Use of polymers of nucleic acid or nucleic acid analogs. Use of gene editing agents to alter genome sequences and the transcriptional, post-transcriptional or epigenetic regulation of gene expression. Use of normal or genetically modified cells. Here are stimulants, narcotics, cannabinoids, glucocorticoids. Here are some categories and example of stimulants, narcotics, and cannabinoids is marijuana, cannabis. In glucocorticoids, we have hydrocortisone, prednisolone, cortisone. Beta blockers, which we have archery, automobile, billiards, darts, golf. Beta blockers are usually to focus some anti-doping agencies. World Anti-Doping Agency, also known as WADA, was established in 1999. The headquarters of WADA is in Montreal, Canada. International Dependence Agency composed and funded equally by the sport movement and government of the world. Its key activities include scientific research, education development of anti-doping capacities, and monitoring of the World Anti-Doping Code. The document harmonizing anti-doping policies in all sport and all countries. The code sets 4 specific anti-doping rule and principle that to be followed by the various anti-doping organizations and respective countries. Work in the conjunction with 6 international standards in various technical areas, namely the prohibited list, testing and investigation, laboratories, therapeutic use of exemptions, protection of privacy, personal information, the code compliance by signatories. National Anti-Doping Agency (NADA) established by Government of India as a registered society in 2005. On 7th March 2008, the National Anti-Doping Agency India accepted the World Anti-Doping Code. The primary function of NADA-RS under to implement the anti-doping code to achieve compliance by all sport organizations in the country, to coordinate dope testing program through all participating stakeholders, to promote anti-doping research and education, to inculcate the value of dope-free sports, to adopt best practice standards and quality systems, to enable effective implementation and continual improvement of the program. Doping is defined as the occurrence of one or more of the anti-doping rule violation. presence of prohibited substance or its metabolite or markers in the athlete sample, use or attempted use by an athlete, evading, refusing, or failing to submit the sample collection, failures to file athlete whereabouts, information and missed tests, tampering or attempted tampering with any part of doping control. Next up, possession of a prohibited substances or a prohibited method, trafficking or attempted trafficking, administration or attempted administration to any athlete in competition or out of the competition, assisting, encouraging, aiding, acting, conspiring, covering, or upon any other type of international complicity. The adverse effect of doping. Anabolic agents, general side effect, greasy skin, acne, infertility, hypertension, liver and kidney dysfunction, aggressive behavior, tumor, male specific effects. We have breast development, testicular atrophy, diminished testosterone production, diminished sperm production, impotence, alopecia, prostate cancer. In female, we have male pattern hair growth and baldness, menstruation, disturbances, decreased size of breast, deeper voice, etc. Hormones and related peptide side effects are increased viscosity of blood, myocardial infarction, cerebral infarction, pulmonary embolism, convulsions. Side effect of growth hormone, acromegaly, soft tissue swelling, abnormal growth of organ, arthropathies, diabetes mellitus. The side effect of growth hormone is menstrual disorder, gynecomastia. Side effect of ACTH, insomnia, hypertension, DM, stomach ulcer, osteoporosis. The side effect of insulin, hypoglycemia, nausea, drowsiness, CNS disturbances. Stimulants. After consuming stimulants, performance under severe circumstances, example as a long period and or in the heat raises the athlete's body temperature intensively, making it difficult to cool down. Cardiovascular malfunction may even lead to death. There are some effects caused by the stimulant: loss of appetite, insomnia, hallucination, trembling, restlessness, hypertension, etc. Other substances are side effect of narcotics in addiction, loss of balance, coordination, nausea, dizziness, insomnia and depression, decreased heart rate, side effect of cannabinoids, impaired balance and coordination, loss of concentration, increase in heart rate, decreased appetite, drowsiness, hallucination. Side effect of glucocorticoids, fluid retention, hyperglycemia, systemic infection, musculoskeletal disorder. Testing of athlete. When will an athlete be tested? Any sports person competing in a national or international event can be asked to give his or her blood and or urine samples at any point of time by anti-doping agency or sports event committee during the event. Testing can be conducted in the competition and out of the competition. Usually athletes who bag the finishing position are tested. In addition, agency can randomly test any accredited athlete even when not participating in an event. The intelligence and investigative team is an important partner in global anti-doping program in the terms of investigating potential anti-doping rule violations, cooperating with law reinforcement to shut down large-scale doping rings, curtailing the trafficking of prohibited substances. Here we have the investigative process. It is to collect, analyze, investigate, and conclude. We collect the information from the parent, official, athletes, interview with the person making the claim, seeking out corroborating events without compromising the confidentiality of the informant. We analyze assigned to the case along with the scientific expert if it is necessary to assess the quality of the information. And the source determine the scope, accuracy, and likelihood of the allegations bulletin report prepared. We investigate the team coordination with internal WADA teams and external partners like anti-doping organization, international federations, and law enforcement. More interviews and analysis conducted to further corroborate the claims. We concluding determination of whether the case requires additional to follow up if the case is closed. At every step along the way, the informant is updated and their identity is kept confidential. Here's a WADA accredited lab in India, the National Anti-Doping Testing Laboratory. The National Dope Testing Laboratory, Ministry of Youth Affairs and Sports. The Ministry of Youth Affairs and Sports, Jalan Stadium Complex in New Delhi. The head of the laboratories is organized by Dr. P.L. Sahu. He is the scientific director. 11 stages of doping control. First, urine, blood can be collected anytime and anywhere for doping control. You will be notified by a doping control officer or chaperone about your selection for doping control. You will be asked to sign a form confirming that you understand your rights and responsibilities. Third, you will report to the doping control station as soon as possible. You will choose a collection vessel from the selection provided. A minimum amount of 90 ml of urine will need to be provided. You will disrobe from knees to navel, from your hands to elbow to provide an unobstructed view of passing of the sample. A DCO or chaperone from the same gender will observe the urine leaving your body. We choose a sample collection kit from the selection provided, split the sample in the A and B bottles. Pour urine up to the line in the B bottle first, next fill the bottle, leaves a small portion for the vessel collection. Seal the A and B bottles. The DCO will measure the specific gravity of sample to ensure it is not to be diluted to analyze. It is too dilute, you may be required to provide additional samples. Next up, you will complete the doping control form by providing personal information, noting any substances you may be taking, the prescription, medication, over-the-counter medication, and supplements, noting concerns or comments if you have any about the doping control. Confirming the information recorded numbers and sample code are correct. Signing and receiving your copy for the doping control form. Last, sample will be sent to WADA, accredited laboratory in strict confidentiality and will be tracked to ensure their security. Your sample will be analyzed and your B sample will be securely stored for the further testing if required. The laboratory will send the result to the responsible anti-doping organization and WADA. The sample testing protocol is out of competition testing, training period, off season. In competition testing, selection, trial, state level, national competition, and international. The urine sample testing protocol, here we can see the recipient of sample, chain of custody, where sample A for stimulant, 1 ml for glycerol, 2 ml anabolic steroid, 2 ml for glucocorticoids, diuretic, and etc. As you can see, the urine sample testing protocol given below. Here's a routine screening of urine sample. The blood sample testing protocol, there are a number of sample. There are two types of sample, a sample A and sample B. The volume required is 2 into 3 ml. The number first screening at the erythropoietin stimulating agent ESA and its analog. Equipment, electrophoresis and sample serum. Human growth hormone, the illuminator and serum. Blood parameters, Sesamex XT 2000I. Whole blood, blood transfusion, flow cytometer. Sample is whole blood. The hemoglobin based oxygen carriers, ELISA reader. The sample taken as serum. The therapeutic use of exemption. Athlete may at times need to use a prohibited medication to treat a legitimate medical condition. A TOE is an exemption that allows an athlete to use for therapeutic purposes only. An otherwise prohibited substance or method of administering a substances. The World Anti-Doping Code therapeutic use of exemption is a mandatory international standard developed as a part of World Anti-Doping Program. An athlete may be granted a TOE if and only if he or she can show by a balance of probability that each of the following condition is met by prohibited substances or prohibited method. in question needed to treat an acute chronic medical condition such that athlete would experience a significant impairment to health if it were to be withheld. No reason therapeutic alternative to its use. Use is high unlikely to produce any additional enhancement of performance beyond what might be anticipated by a return to athlete's normal state of health following the treatment. The necessity for its use is not to consequence wholly or in a part for the prior use without a TOE of another prohibited substances or method. A designer drugs molecules that are deliberately engineered to contain novel modifications so that they may evade detection by targeted drug surveillance procedures or evade current legislation, produced with the intent of developing substances that differ slightly from controlled substances, their chemical structure retaining the pharmacological effect. Example, synthetic ethylene, dihydrogesterone, spice K2, etc. Here are the designer drugs in sports. Use of high targeted method to attain appropriate sensitivity, detect known potent doping agents, but limited coverage with the use of available method. The emergence of designer drugs specially intended to evade detection. The detection of designer drugs is the mass spectrometry and the ELISA method. Here we have in vitro method to study metabolites. Sports medicine. The study of medicine pertaining to sports person include regular health assessment, management of medical history of the people involved in sports activity, and treatment of the sports related injury.